Good afternoon and welcome to Medication Management, February 24th, 2022 panel discussion on the importance of medication management for you or those you care for. Today we have two distinguished guests to help us through this discussion, Dr. Louise Yi Liu from Brightview Health and Kevin Crumley from Mountain Care Pharmacy. And our facilitator for today's discussion is Brooke from Life Changes Elder Care. So thank you, Brooke and Kevin and Dr. Yi for being here today. You can go to the next slide for me, Brooke.
Okay.
So for those of you who are new to LEARN stands for Lifelong Education and Aging Resource Network. We're an Idaho-based nonprofit organization with a mission to provide free community education on aging and caregiving topics. We provide that education at webinars like this, and we record those sessions so that the information is available on demand in our learning library. LEARN is a leaders network of the Society of Certified Senior Advisors, and the SCSA is a duly accredited organization to make sure that the professionals are certified who work with seniors, and we follow their standards for the education that we provide. A disclaimer, we do remind all of our attendees that we are providing this content for general informational purposes only, and we ask you to not consider it to be personal, legal, financial, or health advice. And we do ask you and recommend that you consult with your legal, financial, healthcare, or other service providers before you take personal action on the information you hear today. I would like to acknowledge our two sponsors for our winter series, Oasis Senior Advisors and A Mind for All Seasons. Oasis Senior Advisors is an organization that provides free personal senior living assistance and placement assistance using trusted local advisors. And A Mind for All Seasons is an organization that's leading the revolution in brain health for individuals and institutions based on a very comprehensive approach to brain health and healing. Both of these organizations have sponsored this event and make it possible for us to bring this education to you free of charge. And our two panelists today that I would love to introduce are Dr. Louise Yi Liu from Brightview Health and Kevin Crumley from Mountain Care Pharmacy. So thank you both, Dr. Yi and Kevin, for being here. And without any additional introduction, I'd like to say hello and wave to both of you. And Brooke, I will let you take it from here.
Okay, so let's see here. We go back here.
You can end that show if you.
Maybe. We might just have to stare at it.
If you right click, you should be able to.
Do you want me to stop sharing? Is that what you're saying?
Sure. Yeah, just stop sharing, and that way people can see.
Sure.
Faces. Yep. Perfect.
Okay. So Kevin and Dr. Yi, what I understand you guys are prepared to do is to discuss a little bit about what's most important about medication management. But I wanted to maybe allow each of you to give yourself a chance to introduce who you are and what it is that you do.
For sure. Yeah, go ahead. Go ahead, Dr. Lee.
Okay, so hi guys, I'm Dr. Yi. I'm a family medicine geriatric specialist. I specialize in, people who are 65 and above. I have a private practice in Meridian, and the biggest thing that I've noticed for a lot of my more, older population is that a lot of times there's a lot of medications that are unnecessary. So I think this is going to be a great topic to discuss that you can take back with you to your own primary care physicians and kind of review, and hopefully can get rid of some of the medications.
Okay.
For sure. My name's Kevin Crumley with Mountain Care Pharmacy. I've been with Mountain Care for a little over 10 years now. We started off as a hospice specialty pharmacy and have kind of grown into a lot of different avenues since then. One of which is the medication management field. About a year and a half ago, we noticed there was a big need for this service for a lot of independent seniors. So we've kind of transitioned into this. And I think right now we operate right around 100 seniors at any given point in time on our medication management services. So we're very passionate about this and are really just glad to be here.
Fabulous, thank you. So, Dr. You started off by saying you find that there's likely some unnecessary medications. When someone comes in, what are some of the things that you like them to bring with them or to be able to?
I think one of the biggest things that I would love to see is either a list of medications that includes the dosing, what they think the medication's for, and how often they're taking it, the frequency, because there are times where the medications are taking at the inappropriate timing, or potentially, the population is not understanding how the medication should be taken. So then that can make a huge difference in the side effects and stuff like that. So I think like if a patient can at least have either a list of medications or actually just bring in every single thing, including their supplements, that would help me significantly, because then it can kind of give me an idea of if there's potentially any type of interactions that they may have.
Mm-hmm.
Yeah, and I'd even say on this topic too, Dr. Yee, and you can speak to this a little bit more probably than I can, but what we see on our side is oftentimes patients are seeing multiple physicians, and each of those physicians is prescribing to a different pharmacy. So neither of those pharmacies are speaking with each other.
Right.
Neither of the physicians are speaking with each other. So there's often times where there's multiple medications that are meant to counteract a specific diagnosis that, you should only be taking one of those medications as opposed to two of them, or, just a bunch of different stuff. So I agree with Dr. Yee, bringing in all of your medications, no matter who the provider is or who signed for the medications, bring them in, have your doctors look them over together and see exactly what it is that's being prescribed to you. Because that's a big thing that we run into on a very frequent basis when transitioning patients to our services.
So do you think that's one of the biggest things that people struggle with, is understanding just how to manage all of them, and that they are, that you as a provider or pharmacy need to understand what they're on as a complete package? Or
I think like what Mike was like saying was just that, or Kevin was saying, was saying that, it's just that there's so many specialists involved in one person's life that a lot of times you don't see that maybe they're already put on a blood pressure medication and they're put on another one, and oh my goodness, why am I dizzy now? Or they're on a medication that may end up causing like heartburn, and then now we have to worry about putting them on a heartburn medication, and what kind of side effects are the heartburn medication is going to cause, and so it's just that a lot of times when they come in, it's just that they're on so many different medications that they're trying their best to keep up with all these medication changes, but they're not really understanding what each of them are for. And so, what I do see is the patients just say, this is what my specialist told me, this is what my doctor told me, and I'm just taking what I need to take. And that's, I think, one of the biggest things.
okay, all right. Are there other things that you would like to share that might be something to consider as far as interacting with, whether you have a complete list or, also including your supplements? What other things can interact or interfere with when you're taking medication?
Other things that can interact with food, right? So like, for example, if you're taking a statin, which is essentially for high cholesterol, we're not supposed to take grapefruit juice. We're not supposed to do some kind of, grapefruit extracts, because that actually causes a metabolism problem. So, and then like, for example, if you're taking a thyroid medication, we have to take like the calcium 4 hours later. So those are all types of things that we need to know so that when a patient brings in all of their medications, we can do a comparison, because in multivitamins, they might not notice that, oh, they have selenium and zinc and everything, but they're also taking extra zinc. And the extra amount of zinc is causing a little bit of metal toxicity, right? And so that can cause a little bit of, rash or diarrhea or et cetera, et cetera, et cetera. And so, the supplements are wonderful, but there are still, everything needs to be at a good moderation. It can't be overly taken. But a lot of times when they're giving prescriptions or they're giving supplements, they don't realize that they're taking either double or tripled amount, and that can cause worsening of side effects than actual prescription at that point.
Dr. Lee, one of the things that I notice when we go to the doctor and is that the MA usually ask what our medication list includes. And they ask what we're taking and what the dose is, but they don't normally ask how or when we're taking it.
Right.
What thoughts do you have about that?
So I think it would be really important. So like, if I do a prescription for a brand new medication, I try my best to explain approximately what time needs to be. Most medications, it doesn't really matter what time we take the medication, but there are a few like Armour Thyroid, levothyroxine, those thyroid medications that will need to be taken in the morning, or like Fosamax for osteoporosis that needs to be taken in the morning on an empty stomach, and you have to sit upright for a solid, 30 minutes to 1 hour so that you're actually digesting the food. So, the medications, most of them, you don't really have to particularly say you have to take it at this time, but the few that are out there, hopefully the doctors are going over it with the patients and hopefully really just reiterating it each time they're seeing you, hey, how come your thyroid's not well controlled? Are you taking it right? Are you taking it within 30 minutes and not eating anything? So hopefully doctors are going over that during those scheduled appointments.
Dr. Yee,
sure.
I have a,
Sorry, I was just going to say, there's a ton of different reasonings behind any of that kind of stuff. But the one thing that I would emphasize on some of that as well is, like Dr. Yu was saying, not all of your medications have to be taken at a specific time of day, but there are specific things that we look for on the pharmacy side to help try and decrease things that like pill burden, right? So we don't necessarily, nobody likes having to take, 10 pills first thing in the morning. If we can adjust some of those and work directly with the doctor and try and figure out, okay, could we add this at noon or could we add this at bedtime to try and decrease some of those additional things, because there are different medications that interact differently at the same time or require, like Dr. Yu was saying, to take on an empty stomach or to, just do a bunch of different things. So really asking not only your prescriber about all this stuff, but asking the pharmacist when you're picking the medication up as well will go a long way for you.
So on a similar note, despite setting alarms and having pills set out, doses get missed, right?
Mhm.
And then you have that moment of, okay, I missed this dose. I'm now X hours from my next pill. What is your recommendation there? Is it it's probably okay? Is it better to double up, skip it, or do I call the pharmacy? What do I do?
It depends on the medication. So if they're really confused, ideally, if they can consider talk to a professional, just so that they can make sure they're not taking it too closely together. So like, for example, if some of the blood pressure medication they skip in the morning and they realize, oh my gosh, I need to take it at nighttime, but they have another dose ready scheduled for that day, then my suggestion would be not to take both at the same time, right? Unless their blood pressure just happens to be sky high, then I may say, oh yeah, take the one right now. And then before you're supposed to take the second one, check your blood pressure. If it's back to normal, then you don't need to take it. But definitely if they're more confused about how to take the medication, if they miss a dose, they definitely should talk to a professional just to make sure that they don't end up causing themselves to have low blood pressure, low sugar, or whatnot. So
yeah, and I'd say any pharmacy in town or any provider that they work with directly would be more than willing to answer those questions for them on a very immediate basis. It is something that we run into on a fairly frequent basis, just answering simple questions. Like Dr. Yu was saying, it just depends on the medication. Different things do different things.
Better to be safe than sorry.
Yep,
Mhm.
100%.
I find my pharmacist to be another part of my care team. And so I do really like having one pharmacist, just like one primary care physician, and to help people understand how important that is. Use one pharmacy,
Yes.
except for maybe the time when you have a mail-in pharmacy as well as a pharmacy that's local for short-term immediate prescriptions. But always just use one.
Yes.
Good advice, definitely.
For sure. I would to the utmost degree agree with you on that. It is one of the biggest issues that we see on a day-to-day basis is just like I was saying at the very beginning, is seeing patients that have multiple pharmacies, multiple providers, and they don't talk to each other and they don't know what medication the patient's on fully. They just see what's right in front of them. So I would definitely agree with you. Utilize those pharmacies and those pharmacists as an additional, service, as additional part of your healthcare regimen, because it's a big deal.
So a question for you, Kevin, on that is if somebody is using multiple pharmacies because they get significantly better prices on certain drugs at one pharmacy versus another, how would somebody who's very price sensitive and really needs to get the lowest price make sure that they get that oversight?
Yeah, that's a great question. Honestly, the first thing that I would say is, for the most part, you shouldn't be seeing a ton of difference as far as price is concerned, unless you're talking mail order, 90-day supplies, that kind of stuff. For the most part, the cost that you have at most retail pharmacies is going to be similar if it's processed through insurance. Now, if you're paying cash prices and that kind of stuff, it'll fluctuate a little bit. It can fluctuate a little bit on your copays still. But if you have an instance where it's a cheaper medication at a different pharmacy, the first thing that I would do is ask the pharmacy directly, would you guys match the copay that I'm paying at this other place? Talk directly with the pharmacy. In a lot of different situations, they're more than willing to work with you on the actual pricing of medications. Now, if it's a situation where you are paying a cash price or something along those lines and you need to utilize, even something like GoodRx, right? A service like GoodRx, I would suggest getting a pharmacy that is more than willing to at least keep your medication list on hand so that pharmacist still knows exactly everything that you're taking, even if you aren't filling everything at that particular pharmacy. That way, they still understand the different interactions that you potentially could be having, whether or not they're actually filling with that particular pharmacist or not. I would say it's a good idea to at least find that community partner, right, that will help you and be a good part of your care staff.
And that medication interaction is a really big issue, particularly if you're using multiple pharmacies, multiple doctors. Is there such thing as a self-service? Like, can I go look it up on the internet, or is it really
sure.
I should, where do I?
I mean, it's 2022, right? You can look up anything you want to look up on the internet.
Will I get the right information though? That's the question I want to know.
That's the question that you need to ask right there. Honestly, Google is a great tool as far as at least looking up, brand versus generic, different side effects that can potentially happen. Now, I'll be careful on saying that because, we all kind of have that tendency to go towards the worst possible side effects on some of these things. But I would definitely say you can use the internet as a resource for you. But again, I don't think that there's any better resource out there than getting a good community pharmacy or having your provider that understands, kind of the ins and outs of all of the medications that you're taking, all the diagnoses that you have, and is just really, really a good part of your overall, care.
Okay, I'll take this moment to just invite any of the other participants to certainly put questions in the chat, and we'll make sure to get to those as we're going along. And then make sure I can see the chat. Yes, I can. So from a standpoint of how often, this is kind of a question for both of you, how often do you actually have the opportunity to consult, with the physician or with the pharmacy about maybe a discrepancy or a question of timing of medication or interaction? Does that happen very often?
I can probably tell you from the primary care side of it, we try our best to review each medications each time we're seeing the patient. And of course, if we're running really behind, it's very difficult. But one of the main questions that we always ask is to our patients are, do you have any changes in medication? We may not necessarily go over how are you taking it. If I'm going over lab work, I may actually say, hey, what's going on? Is there something that may have happened? Are we eating something differently? Are we taking up medications? And, you know, at that point, we definitely 100% go over everything. So ideally, in the most ideal world, we are going over each medication each time the physician's seeing a patient. And that should be with each different physicians, not just only the primary care. It should be with the specialist as well. But, you know, it's really, that one's, we're trying, but it's not necessarily always going to happen.
Sure.
But definitely 100%. That's why an annual exam is extremely important, because during an annual exam, especially with Medicare, you know, the thing is, as a physician, we're supposed to review the medication. We're supposed to review the depression score. We're supposed to review everything with them so that we can properly assess to make sure that they are taking it right. So that's from our standpoint, though.
Okay.
Yeah, for sure. I mean, I would love to kind of toot our own horn at this point, for lack of a better word. We pride ourselves on doing that exact thing for all of our medication management patients. And that's what I mean when I say reach out to a community pharmacy. It does not have to be Mountain Care Pharmacy. It can be any community pharmacy. I would just suggest that you find a pharmacy that is willing to do the medication management services for you. There's multiple pharmacies throughout the valley that will take the time, the effort to call providers, to ask providers, you know, can we DC this medication? Can we discontinue this medication? Can we add this? You might want to talk to the patient about adding this medication. We go through and call the actual patient and see how they're feeling, how they've added a new medication. How's it making you feel? Are you feeling different? And try and communicate back to providers about that kind of stuff. We try and go through and do everything possible to do exactly what Dr. Yi is talking about, go through and, you know, actually manage that medication for the patient, because in all reality, most pharmacies are offering it as a free service. So realistically, if we're not utilizing it, you know, it's something that's going to come up and be an issue at some point in time. So if we can try and head that off before it's an issue, all the better, all the better.
Okay. So one thing I was going to bring up, unless anybody else has a question, I'll just check the chat here. So I find that generally people tend to not think of supplements and even over-the-counter medications as something that they need to mention. So Dr. Yi, I think you both touched on that a little bit, but you know, over the counter, especially like when it comes to Tylenol or Tums, or do you tend to ask patients a lot about that? And how much information should they divulge to you when it comes to taking that?
We definitely want to know how often they're taking, especially ibuprofen, any type of NSAIDs, because NSAIDs can cause some damage to the kidneys and stuff. So we definitely talk about that. And then especially since, you know, including myself, we get a lot of pain in our joints, right? After we're working out, we're getting some kind of pain in our joints, and we may tend to just pop in the Tylenol like it's a candy. And so I definitely want to know how much and how often you're taking it. If there's an extra strength that you're taking versus a normal Tylenol, I need to know all of that. So that's going to help me determine whether or not they're overly, you know, overtaking it, if there's too much dosing, or if, you know, they can take more so that they can help with their pain. Ibuprofen can cause a lot of heartburn. And so, you know, if you take too much of that, that can also cause other unnecessary side effects that we want, including kidney problems and not being able to release all the toxins and stuff. So 100%, if anything that's over the counter, we would like to know so that we can make sure that we're not missing a big piece of it. You know, it may seem like it's a minor piece, but it's actually a really big one, because that can tell us a lot of things that's going on in your life on a daily basis.
Yeah, for sure. Yeah, I would just say always tell your provider everything that you're taking. I mean, like Dr. Yu said earlier, there's so many even just different foods that counteract with medications. So definitely any supplements, definitely any over the counters that you take, even on a semi-routinely basis, I would talk to your primary care provider about it.
Okay. What about expiration date? What if the Tylenol says, like, you know, best effective 10 years ago? What do you advise they do?
I would definitely suggest going through your medicine cabinet more often than every 10 years. That would be kind of the start. I mean, there's all kinds of different reasonings behind the expiration date. It's just like anything else as far as food or drug is concerned. They put expiration dates on there for the safety. At no point after the expiration date can they guarantee that the medication is still as stable, is still as potent, is still, you know, is going to work the way that it's supposed to work. So I will just say that from the pharmacy side of things, I would follow those guidelines just like you would follow it on, you know, a pound of ground beef or, you know, a box of cereal or a can of, you know, green beans or something. I would follow that as probably as closely as I possibly could to it.
Okay.
Agreed.
We've got a question in the chat here. It says, is there a reason my provider would want me to take a brand name drug if a generic is available?
The only thing I know different is that majority of the time generic and brand are very much similar. There are certain fillers that may be in the generic that the body may be allergic to. So we try our best, because insurance wants to only cover generic usually. We try our best to give patients the generic brand. But if you're getting a reaction to the generic brand, then the brand name may actually be a better option if there's nothing else available for the patient. So that's the main one that we would do, seeing in our primary care, practice.
Yeah, I would agree there. I mean, just to touch base on that a little bit, I can't remember the exact number, but it's something like the generic has to be within like 95% the same exact formula that the brand is. So that's when Dr. Yi says different fillers, she's talking about different additives that are added to that particular medication to be considered a generic of that brand, though it does have to be within a pretty high percentage of the exact same formula. So that would be about the only thing that I could think of. Dr. Yi, yeah, I can't imagine any other reasoning behind just going with a brand rather than a generic.
Maybe we can take that same idea across to supplements. You know, obviously there's a lot of different brands from that standpoint. So how do you go about judging? Can you truly just find the least expensive one on the shelf?
No. So what I always tell my patients is just make sure that you're looking at the ingredients and really seeing which one has less, unnecessary ingredients in it. I would say the more pure, the better, just because then you're not because if you're allergic to certain types of medication or certain types of additives, like for example, me, I'm allergic to red dye. I have to make sure that there are certain types of supplements that don't have that specific dye in there for me not to get a really bad reaction to it. So in my opinion, I think the less additives, the less ingredients there are, potentially, I feel that it's better. So that's what I always recommend to my patients.
Yeah, I would definitely concur with that. I would say look at the ingredients on the supplement. Just because it's cheaper does not mean that it's the same medication or same anything else. A lot of times what you're paying for on those cheaper ones is those additives, is those different things. If you go and look at any supplement on the counter or in the OTC items anywhere at any pharmacy, you will find more potent varieties or less potent varieties, and usually the ones that have less are the ones that cost less. So yes, I would definitely agree. Just look at the ingredients.
And is that something that generally the pharmacy can help evaluate? Maybe they come out and look at the different brands with the person looking to buy it, or how does that work?
Yeah, definitely. I mean, most pharmacies are going to have somebody that's available to answer those kinds of questions. Now, most of these retail pharmacies anymore are, with everything else going on in the world, they're understaffed. They have a lot less time. I would suggest if you're going to do something along those lines, bring up multiple supplements to the counter and ask questions, just to try and avoid, going up to the counter, asking them to come back with you, taking that extra time and effort and that kind of thing. That again is just to try to save them a little bit of time and effort. But yeah, for the most part, I think you can go through those and look, compare label to label, pull up both those bottles right next to each other. You will be able to tell the difference. And if you can't, then at that point, I would say go ahead and go with the cheaper option. But most of the time, you're going to be able to tell, okay, this one has less of this one has less of that, or more, or vice versa. So yeah.
All right. Got another question in the chat here. If I am taking a medication that is very expensive, is it reasonable to ask my doctor or pharmacist if there is a lower cost drug that might work for me?
Yeah, for sure. I mean, it's your guys' healthcare, right? Like, it's your guys' body, it's your everything else. If you are having a hard time paying for that medication, or if you think there might be a cheaper alternative out there, questions are never a bad thing when it comes to providing, good healthcare service. And I think Dr. Yee would agree with me that, if we can save the patient some money and it does the exact same thing that we're trying to do, by all means, let's make it as best of an outcome for that particular patient. Additionally, there's so many different sources out there anymore for coupon codes or that kind of thing from manufacturers. So I would always just again, this goes back to getting those good community partners. Anytime that I see expensive medications come through, the first thing that we try and do is find any kind of coupons, any kind of manufacturer coupons, any kind of anything that we can try and save a little bit of money for that patient, because we understand. I mean, a lot of our patients are on limited income, but additionally, there's things that we can do. We can talk to, if you're on Medicare, we can talk to Medicare specialists to try and up your plan for the next time around. Like, there's so many different options and opportunities that I would just suggest, again, finding that good community partner. And I did see it popped up, where do you find these coupons? That's a great question. A lot of the times the manufacturer coupons will be specifically brand related, to go back to that. So typically what I'll do is look up the actual brand again on the internet, and see if, hey, is there a manufacturer coupon for this Lyrica or Eliquis or something along those lines. And oftentimes, depending on financial troubles and that kind of stuff, there is.
Okay. Dr. Yee, I was going to go back to something that you brought up. You mentioned that when you look for supplements, that you have to watch out for a red dye because you have a sensitivity or allergy to that. So if somebody starts a new medication or supplement, what are some things they need to be aware of that could be, a reaction to that? Maybe even if it's not like, something sudden, obviously you may realize it, but what are some things people should watch for?
I mean, the main thing is, I think the most common would be just hives, having stomach upset. So usually a patient takes it after a day or two, they will actually start complaining about severe itching, or, they're just not feeling well, joint pains. So essentially it just, if they have a question about it, and if they're thinking that maybe potentially it could be the new medication, they should talk to us or talk to the pharmacist just to see if that potentially is one of the side effects. When they're seeing a list of, all the side effects that may potentially happen with each medication, it's because anybody who has taken a medication, if there's one person with a side effect of it, they have to document it through FDA. It's just a necessity. So even though there's 100, 200 list of side effects, majority of the time, it's just that somebody did have a side effect and we don't know, right? We don't know how our body genetically or metabolizes or anything. So if they have a question about it, they definitely should ask and see if it's potentially a side effect.
Okay, thank you. The dog's going to decide to bark a little bit in the background.
It happens.
It does. Very helpful. So how long would they expect, if they stop taking that, would they expect a medication, prescribed medication, or a supplement to be out of their system?
It really depends on how long they have been taking a medication. That's probably the number one thing. So if they've taken it for a prolonged period of time, then it's going to take a little bit longer because there's quite a bit more medication in their body that they would have to metabolize. If they've taken it for a shorter period of time, usually it's a lot quicker. Usually if they stop the medication, it kind of just gets out of their system. It just depends on what kind of enzymes we have in our body. The liver enzyme is a huge thing. If there are, people who have higher amount of certain types of enzymes, that specific medication will be digested a lot faster. If they have a little bit less of that specific medication, it might digest a little bit slower. So each person is very different. It's very hard to say how long is it going to be in your body, but usually the shorter the time period that you've taken a medication, the faster the reaction goes away. And then, if it's longer, usually a bit longer.
Other questions here? No. There's a few other things I had written down here. Well, here's one that might be good to talk about is when would it be helpful to take a drug holiday from either a prescription medication or even a supplement or over-the-counter medication?
That would be something you have to talk with your doctor. It's not something that we can just say, oh yeah, this is a drug holiday, we can totally do it. Each medication is very different. So I definitely would say before you do any type of drug holiday, you need to talk with your doctor first and see if it's feasible. And like a blood pressure medication, you cannot take a drug holiday from blood pressure medication.
No, please don't.
No.
Or diabetes medication. But like
Right.
if you have a Fosamax, which is for osteoporosis, and you've been on it for 5 years, then yeah, at that point you should definitely talk to your doctor about taking a drug holiday. So it's just really, really medication dependent, and you definitely have to talk to the physician or the pharmacist and everything before you do anything like that.
Yes, please.
Right. Before you self-medicate and stop taking.
What
Mhm.
is the benefit of a drug holiday? What could that show me or do for me if I were
So,
to?
for example, if you take omeprazole, and unfortunately, when a lot of patients are actually being discharged from the hospital with omeprazole, which usually is a kind of like a checkbox for the physicians in the hospital, is because they don't want anybody to complain about heartburn, And when they get discharged, majority of them are being discharged with that specific medication. But the patients are not seeing that, oh, this is a whole new medication. I'm just taking what I should be. And so, if omeprazole is taken for too long, it can cause some osteoporosis. It can cause C. diff. It can cause other side effects that it's unwanted. So omeprazole is like an example of one that I would say, hey, let's try a drug holiday. If you don't have any heartburn symptoms after about 2 or 3 weeks or even 1 month, then that most likely is one of the medications that you will not need at that time. So that's what a drug holiday means, just stopping it for a short period of time to see if specific things are going to happen again, recurrence. So like if I stop the Fosamax for about a year, right, then I check a bone scan and my osteoporosis got a lot worse. Oh my goodness, we know that Fosamax is necessary for you as a patient.
Okay, good point. Let's see here. Any other questions?
What methods might you recommend for keeping track of a lot of medications that have to be taken at various times of the day? Pill sorters, dispensing machines, pill packs. I mean, what from the medication adherence perspective, what have you seen works well for patients?
I think for my patients, a lot of times it's just a pill box, the one that has an AM and PM. Occasionally, you also recommend, just doing an Excel sheet. You can put it on a calendar and just checking off with the calendar, saying that, okay, I did take the medication as you're going. I think that one is very, very important for potentially patients who have memory loss, so that they can remind themselves that they did take it and not to overtake the medications or second guess themselves.
And like I said, there's a lot of pharmacies out there that do this exact thing for you at no additional cost. Obviously, the more technologically advanced you get with it, the ones that send you reminders or pop up with alerts or that kind of thing, or require monthly subscriptions or whatever else, they tend to be a little bit costly. But one thing that we do is we have these medication blister cards that we literally do here in the pharmacy. So we go through and say, okay, here's all of your morning doses. So we put it through Monday through Sunday, and it's all just there ready for you to go. It's basically like those little, pill pop packs, just all set up directly through the pharmacy. So you don't have to worry about sorting your medications when you get them. And like I said, there's multiple pharmacies throughout the valley that will do this kind of service for you for no additional cost. And it makes life a lot easier. I don't know about you guys, but my biggest goal in getting older is to stay as independent as long as I possibly can, right? So one thing that we've noticed, and this is not just here in the Valley, it's nationally, is that the biggest reason that patients go from an independent status to either, an assisted living, a certified nursing facility, onto hospice is because of medication mismanagement. So this is something that if we can get more patients utilizing these free services and these services that the pharmacy provides, the longer that they are going to stay independent. I don't know how many patients that we have currently that without this service would be, in an assisted living facility, or they would have been hospitalized at some point in time. This is a service that family members can use. I mean, my wife uses this. She takes 4 medications a day. Like it doesn't have to be a huge, big need, but I would definitely suggest doing something along these lines sooner rather than later as far as your medication management is concerned, because by the time you realize that you're having an issue with managing your medications, it's already too late. Like Dr. Yu was saying, you're already missing doses, you're not taking the medications the way that they were prescribed to do. And oftentimes it's family members that are finding out that this is not being taken the right way. So I would just suggest, again, reach out to your community providers. There are people out there that are willing to do this service for free. There's also additional, services where people will come in and actually package your medications for you on a daily basis. But utilize those services that are there for you would be my just biggest, takeaway from this entire event. Is there is so many different avenues to go down that really can help you stay as independent as long as possible.
Well, and in the case of the pill pack bubbles, man, I don't know that is just for people who are older. That's for the busy professional who can't remember whether they took their vitamins this morning. Not saying I ever ask myself that question like 3 times a week.
These things come in super handy. I mean, you don't have to be 65 or older to get it. It's a free service that we offer. I know there's at least a few other pharmacies in the Valley that not quite the same style of packaging, but offer free packaging and free service like that. So,
and are supplements ever included in that, or just prescriptions?
Yeah, no, great question. We can add supplements to it. We can add over the counters to it. We can add prescriptions to it. Basically anything that you're planning on taking on a routine basis can be added to those packages. It's a great, pretty simple and easy service.
So I have a question, Dr. Yee, about if somebody's seeing you about something that, they may need medication for, but they would prefer not to take a prescription medication, or they might like to pursue something that's non-medical. How do they go about, kind of advocating for that, or what questions do you suggest they ask? Or
again, it depends on what symptoms and what diagnosis they're treating. If it's for atrial fibrillation, I'm not going to say you should not be on a blood thinner. If you're on a diabetes medication and your A1C is like off the chart, which is a really, really high blood sugar, I would not advocate, I wouldn't be able to, advocate for you to stop the medication. So it really depends on the specific medications and what it's actually treating. That would be the biggest thing. If a patient tells me, they're getting older and they're not really looking to further treat specific disease process, and they're okay with their body naturally, going the way it should go, then we would honor that wish. But if they're fairly healthy and we're just trying to keep everything under control, then again, it would totally depend on which medication and what they're actually treating for.
Okay. So I'm going to see if I can think of an example. What if somebody's having trouble sleeping?
If a patient's having trouble sleeping, there are multiple different things that we can try, right? The first thing that we always say is make sure the actual environment is there. Make sure it's a blackout. Make sure that you're not having a TV running in the background. Make sure that you're not having a lot of interruptions while you're sleeping. So environment is going to be the biggest thing. So if we can try to minimize and try not to take medication, that'll be the biggest, right? Like that's the first thing. Are you exercising before you're sleeping? That's going to increase your heart rate. That's going to increase, your blood flow. So of course you're not going to be falling asleep, if you're working out in the morning time and then around like 3 or 4, you're taking a nap, then of course you're not going to be sleeping. So all of that is going to make a huge difference for all of us. It may just be that you need to take a warm shower, drink some warm milk. That's going to just help calm you. That would be an ideal thought for insomnia. Let's just say that you've changed everything and you're in a very beautiful environment, ideal, perfect environment. Then you're like, okay, I'm still not sleeping well. So then, you have a discussion with your doctor. Am I having hot flashes? Am I having, just anxiety about sleeping? Am I having night terrors, nightmares? All of those things that should be assessed before a medication should be given to a patient. So if you're having hot flashes, potentially that's just a hormonal imbalance in our body, right? And then we would treat the hormones first before we give melatonin, Ambien, all of that. So, but let's just say that you're not having that, and it's mainly because you're having anxiety, or maybe because you're having potentially just, like nightmares, for example. Well, could the nightmares, because I do have one patient who has a lot of night terrors, and we've been trying all different types of medication and all types of different environmental changes in him to see if we can help him, right? And so at that point, we try to change the medications around. We try not to stack medications and see what we can utilize. So I would say environment, then potentially, possibly hormones, potentially melatonin. Then it would be like more prescription related medications like trazodone, Remron. I try to use anything that's controlled substances last if possible, because that's very addicting and it can be very dependent. So I try to minimize that as much as possible, because then they're a much higher fall risk as well. So all of those will be a factor into my decision on what we can do to help with the sleeping.
And I would just go back to, I think a lot of this, or a lot of these questions go back to, just being honest and telling your doctor about what is going on. Like, we all have embarrassing things. We all have, whatever else it is. The thing that I've found that goes the farthest is literally just having that conversation with your provider. Telling them everything there is to tell them about what's going on. And then we get to the point where we get truthful and we get honest, and we, are actually looking at what are the root causes of all of this stuff, which is going to provide a better overall service and a better overall experience as far as healthcare is concerned for all of us, right? So that would just be what I would take away from literally every question we've had at this point is
Right.
Talk to your providers, like let them know what's going on in your life.
Build that relationship with them and let them get to know who you are at home. And yeah, I think definitely very consistent theme. We talked a little bit about medication levels in the system when we were looking at, I think we were talking about drug holiday possibly, but I'm just curious, are there any lab tests that somebody should advocate they get for themselves if they're on a lot of medications to see if there's any harmful things happening in their body? Is that something that's part of just a wellness check?
That's usually just a normal regular lab. So like if a patient is overly medicated, we often check the kidneys, the livers, it just depends on which medication you're on. And as a physician, we would potentially know which organ or what blood cells it's affecting. And so we would check the appropriate side effects by labs or by just overall symptoms. So like, for example, if a patient is on, clonazepam, which is a like antipsychotic medication, I would check a CBC to make sure that, their hemoglobin is high enough, because it can cause the breakdown of cells. If they're on a lot of water pill like Lasix or spironolactone or hydrochlorothiazide, I would check their kidney function on a regular basis, potassium on a regular basis, because it can cause a little bit of imbalance, and then I would replace appropriately. So depending on which medication, a physician should know, approximately when they should be checking and rechecking their lab level for sure.
Good. One more here. From a pharmacy standpoint, or actually insurance, I had something written down here. Why do insurance companies have so much input on the medications that are prescribed?
Oh gosh.
That's cute. I'm not even gonna talk about that one.
Yeah,
That's
I'll let this go to Dr. Yee. No, so there's a multitude of different reasons, right? So one of the main things that we keep talking about is having and finding that main pharmacy provider, right? Not having multiple pharmacies, not having multiple doctors that are prescribing different medications. The way the insurances were initially set up was to try and catch some of these issues, right? So if you have the same medication, or if you have two of the same, two medications that treat the same disease state, a lot of it was initially set up to try and catch any of these extra medications, try and catch, some of that kind of thing. Now, obviously, insurance companies are a business, right? And if a business isn't making money, then a business isn't in business. Not that I'm advocating for insurance companies at all, because they love to just come and try and claw back as much money from pharmacies as they possibly can. But they are set up in a manner to try and make as much money as they possibly can. So they're going to do the things where they're trying to get things like PAs, where they need the physician's approval before they actually allow you to fill a script. So it doesn't make any sense to me that a physician writes a prescription, the patient takes it to a pharmacy, the pharmacy bills the insurance, and then the insurance says, no, I don't believe any of you guys. I'm going to go back and I need an actual signed form from the physician. And at that point, the pharmacy has to go back to the physician, get a PA for the medication, and it's all in just such a manner that they're trying to lower their overall cost. It kind of is what it is. I would treat it in such a similar manner to how you would treat any other company. You have, for the most part, always have options as far as insurance is concerned, or plans that you are on. So I would just say be an advocate for yourself in those situations. Go through and figure out what prescription plan you're on. Again, there's always options as far as cash pricing and that kind of stuff is concerned. But again, all of this comes back to being and getting to the point where you're working with that community partner that is looking to kind of do their best to help you out. We oftentimes run claims through insurance where it's more expensive through the insurance than it is to go through our cash pricing. At that point in time, we'll let you know that that's the case, and we can try and avoid having to bill the insurance if we can. Obviously, there's things just like regular insurance with deductibles and everything else that you have to meet, but there's not a great answer to that, to be honest with you. Insurance companies, they're going to try and do what they can to make money.
They're in business after all.
Yeah.
They're in business after all. Okay. Well, I guess this kind of leads a similar topic from an insurance standpoint. How can somebody go about getting an emergency backup supply of medication?
Yeah. So there's a couple of different ways. First thing that we can do is actually come into the pharmacy and explain what's going on. Please try not to come in to the pharmacy if you are completely out of medications. Don't come in, but
Don't wait.
Don't wait until you're completely out of medication before you come in for an emergency supply. Everybody's well aware that every once in a while tablets get dropped or dropped down the drain, or misplaced or whatever else. There are things that we can do on the pharmacy side to reach out to the insurance and say, hey, they lost this, or hey, they need this emergency backup. Oftentimes when there's severe weather and that kind of thing, insurance companies allow for emergency backups. Usually that's in more weather affected areas than Idaho. But there are definitely things that the pharmacy can do to try and get those backup supply of medications. If you're going out of town on vacation and your refill happens to be when you're out of town on vacation, those kind of things are completely acceptable. It's just something that we have to communicate to the insurance, and don't anticipate it being a quick response back. It is going to take some time. So do not, show up 2 hours before your flight's supposed to leave. Give us some time to work on it, work with the insurance companies. Because again, they're going to try and say, no, that medication can't be filled. It's not due for another, 15 days. So we're going to have to go through all the necessary steps to try and get that medication filled before, you actually run out, or before you leave on vacation, or whatever else it is.
Okay. So if you're getting it an emergency backup because you think there's going to be some possibility you can't have access to a pharmacy, or how do you recommend medications being stored? If it's like a backup, or just any medications, where should they be stored?
So most of the medications that you get are going to have some kind of storage suggestions on them. If they need to be refrigerated, they should have a sticker on them that says keep refrigerated. For the most part, I would treat it very similar to, again, going back to foods, right? Like you would with bananas, or with, even like something like cereal. Keep it in a dry, cooler area. Keep it in the same type of area at all times. The last thing we want to do is try and throw our medication, like an entire vial, in our purse, and then carry that around, and then leave it in the car, and it freezes, and then it melts. And I mean, I've seen people leave medications in cars and all the pills melt together. So I would just suggest keeping stuff as temperate as possible, in kind of that 65 to 75 degree temperature range. Obviously, if you need to bring an additional dose or something along those lines, for sure, bring it with you. Just please don't leave it in those situations on a frequent basis. Every time the temperature changes up and down, depending on the makeup of the medication, a lot of different things can happen. Potency can go down. They can melt together. Just a multitude of factors. So I would just say store it the way that you would store, any kind of food, unless it's a situation where it says, refrigerate or freeze, or, whatever else.
Okay. Well, on that same note, let's say we get to stop taking medications and we figured out that, we need to get rid of a few. What's your recommended avenue of disposing of medication?
Yeah, this is actually a great question, because this has come up a lot recently, especially in the news, right? So we hear about, the war on opioids and all of that. There's a great service that almost every police office, if you will, operates. I don't know if you've driven by any of them locally, but they all have places where you can actually drop off and dispose of medications sitting right out front. Additionally, quite a few pharmacies will dispose of medication. It's not as popular, but for the most part, I would suggest getting a hold of your local police department and asking them directly if they have a medication drop off. Oftentimes, even if they don't have a drop off directly on site, they'll offer like quarterly pickups or quarterly drop offs, where they actually have a disposal company that comes in and takes those medications on a specific day or a week. So those are kind of the best options that I see most of the time.
But you do recommend, like, if you have some left over and you're not using it anymore, you both recommend, I imagine, that you should dispose of it and not save it.
Yes. Yeah, that goes back to your expiration dates, right? It's just the same kind of thing. We don't know how potent it is. Don't hold on to antibiotics past the expiration date. They're not going to, they're not going to work the way that you want them to work. I don't know the last time that I, didn't get a new prescription. It's not like a doctor is going to say, no, you can't have antibiotics if you are suffering from strep throat or something along those lines. So, dispose of those medications. It's better off. The last thing you want to have happen is, a grandchild or, somebody else walk in and get into old medication that you've got stored somewhere. It's just so much easier just dispose of what you're not using.
Okay. Was there anything that we haven't touched on that either of you wanted to maybe be able to bring up today before we call it a day?
Let's see. I think we covered pretty much everything we kind of wanted to cover. I would just go back to, the theme of all of this, get with your providers, utilize, there's a lot of passionate people like Dr. Yee out there that are willing to, go that extra mile for you, that will look at all the medications that you're taking, that will, listen to what your concerns are, advocate for yourself, and find those providers that are willing to do that for you.
100%. I mean, the biggest thing is all my patients we're a team. So, if you have a side effect, I'm not living inside your body. So I really want to hear it. I really want to know that this is all happening so that we can change something, because we shouldn't be living in misery. That's the reason why we have a doctor, right? It's just so that we can address what is necessary. So, make sure that, don't be afraid to actually speak up for yourself, because what we know, what we learn, what we have, from our experience, it may not necessarily be the best idea for your body. So 100% work with your provider, work with the pharmacist and say, hey, there's something going on. I just don't feel like it's right. And just let us know so that we can make a change, because it could be the side effect of the medication. It could be related to something that we did, make change to, and so that we can address it appropriately and not have you live, uncomfortably.
Right. Well, if there was anything I would add in the end, is that I've seen empowering for a lot of our clients is just having a list of your medications, no matter how young or old you are. If somebody needs to help you with them, then it's going to be easy, obviously, if you have that listed and even on the refrigerator. So.
Well, and we live in the day and age of mobile computers in your pockets. My suggestion to that is always to just have it on your cell phone. I don't know how many times I've gone into the ER with, my wife or with whomever else. And that's one of the first questions that somebody asks you is, what kind of medications are you taking? So having that list readily available for any provider at any given point in time, it saves so much time and effort on the back end if there is kind of an emergency situation.
Agreed. Well, thank you both, Dr. Yee and Kevin. I think I need to share another slide here at the end. Let's see here. One moment. Looks like Dee and Dara have signed off. Let's see here. Share screen. All right. So again, we wanted to thank our panelists, Dr. Louise Yee Liu and Kevin Crumley, also our sponsors, Oasis Senior Advisors and A Mind for All Seasons. And we wanted to invite you to, all attendees will receive an email inviting them to join the mailing list. You will need to confirm the subscription in that email. So that you can receive information about upcoming educational opportunities. If you don't see it in your inbox, be sure to check your junk folder for the mailing list invitation. Upcoming events, we have on March 3rd, Benefits of Palliative Care. On the 15th, The Art of Long-Term Care Planning. And on the 29th, Living Well with Diabetes and Chronic Pain. And there will be a spring class schedule coming up. And as always, all of these events are recorded and available on the website if you want to share with a loved one, a friend, or if you just like to go back and view it again. So I'd like to thank you all for joining us and wish you a great afternoon.